Hi, my name is Sarah Burton. I'm going to be talking about my final project for Allied Health. I'm going to be talking about my two career choices. My two career choices as of right now are physical therapy and I'm going to try or a pharmacist. So, as of right now, I am currently majoring in physical therapy. This has kind of been something I've been looking into the last year or so. But my first couple years of high school, I had a CTE and I was in the pharmacy program. So this is something that I'm kind of familiar with. And I kind of I knew a little bit about it before researching it. So when researching these two options, I kind of knew a little bit about each, but not enough to have it like information for myself. So when I started researching, I got most of my information out of the book. So for the first slide, I'm going to talk about the day-to-day work. So for pharmacists, they usually will help other like professionals in the health field, I would say, and they help like dispense drugs. They help give information out to other health professionals. They help prescribe drugs. They fill prescriptions, and they do everything basically pertaining to drugs. They can also help order medical supplies, and they have also been shown to help with fellow students that are in the medical field. So that's going to different universities and possibly teaching a lecture or just helping with the class and helping teach kids about the many different like medicines. And then for the day-to-day work for a physical therapist, that is basically providing function and restoring function and mobility, and will help relieve pain and prevent or limit physical disability. So basically, if you've gotten in an accident and you broke your arm or leg or something like that, a physical therapist will help give exercises and will help you to basically get back on track. So, I mean, most of the time I think I'm sure at least once in everybody's lifetime, they might have to go through physical therapy. I have not so far. The only thing I've got close to physical therapy was with my trainer. So physical therapy they will they usually go over your patient history and do tests. And then after they get the test results back, they will create a treatment plan. For this treatment plan, they'll make a like exercise plan. Then they will make they'll basically give you all the information you need to know about recovering from this ailment or disability. So for employment opportunities, when researching employment opportunities, there was a decent amount I found in the area I'm looking for. So I'm currently from Myrtle Beach, South Carolina, and I am thinking about after college going to Charleston, South Carolina, because I've always found like a really pretty area. So when I was looking at different careers and looking where I could find it, first thing I thought it was Charleston, South Carolina. So when I was looking at employment opportunities, there was a decent amount. And so the first one I found that I was actually kind of interested in was in Charleston, South Carolina, and the title is called a clinical pharmacy specialist. And this job would be a full-time at the Medical University of South Carolina. And then from when I was looking for physical therapists, there are also a lot of options too for physical therapy. And the one example I found was also in Charleston, South Carolina at a place called ATI Physical Therapy. And this job would also be a full-time position. So for salary, the salary difference between both of them are pretty big. For just the medium wage for pharmacy was 120,000, and the medium range was 106 to 138,000, and the lowest you could currently make is about 90,000, and the highest you can currently make is about 150,000. So when then looking at physical therapy, the medium range was 82,000, and then the middle 50% was 68 to 96,000, and the lowest amount earned was 56,000. The highest percent earned was 116,000. So comparing numbers, a pharmacist makes almost $40,000 more than a physical therapist. So with knowledge and skills, a pharmacist and a physical therapist are kind of close, but they're also a little bit different. So pharmacists, they must possess a scientific aptitude, a desire to help others, and good interpersonal skills. And they must also pay close attention to detail. So being a pharmacist, you're going to be working in a lab around a lot of drugs, so you're going to need to know all the knowledge between each drug and all their side effects. And you're going to need to pay close attention to which drugs you're using and which ones you're not. With physical therapy, they need to be able to communicate, have physical stamina, interpersonal skills, detail orientation, compassion, and time management skills. So there's a couple similarities with being a pharmacist and physical therapist, but there are differences. For both, you're going to be on your feet most of the day, and you're going to need physical stamina. And then for both of them, you're going to need good interpersonal skills, and you're going to need to pay close attention to detail and have good detail orientation. And then for education-wise, a pharmacist, you can be licensed, in all 50 states, a license is required to be a pharmacist. A pharmacist must earn a doctorate or a PharmD. They must also pass several examinations. So after getting a master's degree or bachelor's degree from college, I would need to get my doctorate. And then to be a physical therapist, we will need a bachelor degree from a physical therapy program. And then we'll typically need a doctoral degree. These programs each last about 3 years. To get a doctoral program, you will need a bachelor's degree. So to get into the doctoral program, I will first off need a bachelor's degree and to complete the prerequisites before getting into the program. So the work environment they're kind of different. For pharmacists, you're pretty much going to be working in small labs. Usually the pharmacists, they work in pretty clean, well-lit, well-ventilated small laboratories. In the lab, there are a lot of drugs. There could also be refrigerated items. Most medicines are kept in lock and key to prevent people breaking in and getting different drugs. Most pharmacists are pretty much on their feet all day working in the lab, going back and forth, whether it's in a lab or a hospital. And most of the time, they will wear gloves and masks depending on what they are working on. So for physical therapists, they will mostly practice in hospitals, private offices, clinics. Some even work in schools. They also treat patients in hospital rooms, schools, and homes. Being a physical therapist can be very physically demanding. You're pretty much on your feet, moving the whole day, working with patients, helping them with exercises. You can also lift a lot of heavy things. You're kneeling most of the time, and you stand for long periods of time, just like a pharmacist. So after doing my research, I really am interested in pharmacy. This is something I'm going to look more into as a different career. But basically, in this slide, I basically went over everything I learned from the presentation. So pharmacy is pretty close to physical therapy, so it wouldn't be too much of a difference, but there still is a lot of differences because the day-to-day work is drastically different. And then for a physical therapist, after doing my research, I'm still pretty interested in physical therapy. It's just something I'm really going to have to, do more research on too. After doing more classes and getting into it more, I'm going to see if I like it. But the main difference between the two that's going to make a good difference between my decision is honestly the salary. So with pharmacy, if I do more research and I do love the aspect of it, I would choose pharmacy just because they do make a lot more money. So if I do keep pursuing physical therapy and I really do like it, then I will stick with physical therapy. And if I research more in pharmacy, I don't like it, I definitely will stick with physical therapy. Alright, that's my presentation. These are my references, and thank you.